Welcome, and thank you all for joining us this evening for the third session of our series, Reimagining Public Health for New York City. Tonight's session will focus on building narrative power for health equity and racial justice. This series is in collaboration with our partner, the Fund for Public Health, New York. To bring about durable change, we must reshape the narrative about what creates health. We need to do this by shifting the locus of power into communities and building local ecosystems for health in ways that reclaim the social justice roots of public health. We know that to confront racism, white supremacy, and the systems of power that harm our neighbors and our family members, we need to challenge deeply held assumptions, practices, and mindsets. Many at the New York City Health Department and across NYC agencies and organizations are doing this work, consistently identifying and challenging narratives that reinforce existing relations of power and that often render injustice as a natural consequence of institutions and systems. You are helping us take vital action to eliminate inequities, which we must realize is the same thing as promoting the health of all New Yorkers. Allow me to say it again. Eliminating social inequities is the same thing as promoting the health of all New Yorkers. Thank you for your passion and for your commitment to this work. Now, our Reimagining Public Health for New York City series engages public health leaders and cultural advocates to help foster new ideas for what a city rooted in racial justice, equity, and community power could be. We chose the word reimagining deliberately, particularly at this moment in the pandemic. Our challenge is to conjure up something that is consistent with the world that we know, and yet is something that has never been seen. And to do so in a way that moves us from the realm of ideas into a time of action. Tonight, we are so grateful to welcome Jennifer Jones-Austin as our moderator. She is joined by outstanding panelists who will discuss how we can disrupt narratives that perpetuate racism and build narrative power to reimagine a city that we all want to live in, connecting equity to human flourishing. I'm so excited for this timely and important conversation. But first, to set the stage, please welcome Brooklyn-born poet and singer, Chanel Gabriel.
Hello, my name is Chanel Gabriel. I'm a poet, singer, and artist from Brooklyn, New York. And it's such a privilege to be able to be here. Thank you so much to the Commissioner of New York City's Department of Health, Dr. Dave Choksi, for the intro. And thank you so much, Dr. Easterling and Dr. Morse, for hosting this important conversation. It's so necessary. So the piece I'm going to share with you all as a poet is going to be very much based on perfectionism. And how a lot of times we think of that as an internal thing, but with the pressures of society, of existing as a person who has been minoritized, as a Black person, Black woman, in many workplace settings, a lot of times the pressure that is there can affect our mental health. And it is not internal. It is definitely something that is a part of this conversation on equity, who deserves to be valued and what that feels like. So here's this poem. I have been told that I need to be flawless. My brilliance needs to shine even through the shadows of doubt cast upon me. Expected to always display a heavenly clarity, a jewel placed in a predetermined setting, but constantly told that I don't fit. Told that I am a counterfeit. Treat me like my diamond cannot chip this glass ceiling, that there is no shine able to qualify me for what I spent years of school and experience to be. I am to solve puzzles with pieces missing, break day along with parts of my spirit till the tasks of 3 job titles are complete. There is no tolerance for less than 24/7. Vacation days are luxuries I cannot afford to take. I plan necessary surgeries around company schedules, scared to call out when I'm sick because they'll find something that I've missed. And while they dangle pink slips on wrists as if I should know that I can be easily cut, that I am a jewel placed in an oppressive setting, told I should be happy with my chains, told I am lucky to be the only soul black woman, which makes me question if everyone believes I'm here to hit quotas for diversity, the stress of my silent suffering, the quiet rage, the hurt of never being enough weighs heavy on my brain. Am I wrong? Am I wrong to feel like imposter if they have imposed these insecurities on me? Not a syndrome, but a symptom of the way I'm treated continuously, fighting to push back against the people doubting my brilliance and abilities while simultaneously praising mediocrity with no one seeing. It's me keeping everything afloat. Anyone ever question how racial tokenization, whitewashing, constant self-polishing wears away at the soul can affect us mentally? Wondering why nothing I do can help them see the way I shine. The divine perfect light of Nikki Giovanni. I am a star, building children like pyramids in need of that level of confidence. I am a jewel in need of a new appraiser because my gender, skin, and kin will have them list my value lower, treat me as expendable when I am the holder of everything that keeps this place in motion. I am the jewel, having to constantly remind myself none of these people have degrees in gemology. They don't have the tools to count my carats, the true falsities in their belief in meritocracy. I should be allowed to express my humanity. I can be flawed, but still be high quality. My actions don't need to bear the weight of representing my entire community, speaking myself into clarity. My culture is my carbon. I do not need the pressure of whiteness in order to grow. My worth is in my why. And I won't give my heart to a job that won't understand that outside of my 9 to 5, I deserve to have a life. I deserve mental health days. I deserve quality health insurance. I deserve a living wage. I deserve the ability to breathe. So when we speak of equity, it's not just economically. We speak of a release from emotional and mental slavery. I deserve to have my wellness be preserved. This diamond has been heated and has not shattered. This jewel will not be buried. I am more than worthy. Watch this black bloom. I belong and should feel safety anywhere I plant my feet. Thank you.
Thank you, Chanel. Thank you for sharing your talent and grounding us in this space this evening. I have to tell you that, I'm just taking it all in this moment. I am breathing heavily because in your words, you spoke the truth for so many. And in so doing, you set the stage for this conversation tonight. So I just can't thank you enough, Chanel, for bringing your truth to this platform this evening. I want to thank Dr. Chosky for his introduction, his warm introduction of me, and for inviting me to the table this evening for a very critical and essential conversation. And I want to welcome all of you, just as Dr. Chosky did. I want to welcome you all to this third session in the series, Reimagining Public Health for New York City. This series forces conversations and dialogue about important topics facing public health here in New York City. It helps foster a reimagining and building of the city we all want to live in, one rooted in values of racial justice, equity, and community power. It sets the path for this powerful opportunity to make transformative change. Tonight's focus on narrative power is elemental to our conversations around reimagining public health in New York City. Our current moment, the moment we're in, and we're in this moment all together, we're purposed to be in this moment. This moment presents a historic opportunity for us as the city's Department of Health and Mental Hygiene, and as a city to challenge and change the dominant narratives which are deeply pervasive and uphold white supremacy. As the commissioner said in his opening, we have the opportunity to bring about real and lasting social change. Many of the dominant narratives, which are shared systems of meaning woven into the fabric of everyday life, reinforce existing relations of power, are rooted in structural racism, and often render social injustice as natural and inevitable. It has become apparent how much is at stake in what narratives dominate and whose and what stories we hear. It's time to challenge and collectively change deeply held assumptions, values, practices, and mindsets. It's time to transform and inscribe a compelling narrative for racial justice. Doing so is essential for advancing and achieving health equity. Narratives provide a foundational framework for understanding both history and current events and inform our basic concepts of identity, community, and belonging. This evening, by focusing on this topic, we have the opportunity to discuss, share ideas and strategies about how we can collectively challenge and change the dominant narratives that often imprison public health and our institutions and perpetuate injustice. We have the opportunity to work towards reclaiming deep narratives that are based on principles and values of social justice and that advance the health and well-being of the communities we serve. It's time for us to begin, and for many to continue, the process for envisioning an equitable future and fostering intentional spaces for reflection, exploration, and learning about this. During tonight's session, we will discuss the concepts of narrative power and explore strategies for advancing effective, compelling narratives rooted in values of social justice and health equity. We will hear from an amazing panel of leaders and advocates discussing how we can collectively disrupt the narratives that perpetuate racism, inequality, and harm people's health, and instead build narrative power to reimagine and create the city that we want to live in. Our panelists this evening are Amity Pei, Interim Director of Storytelling and Marketing and Senior Director of Communications at Color of Change. T. Morgan Dixon, CEO of Girl Trek, the largest health movement in America for Black women. Carla Conejo Villavicencio, author of the prized and acclaimed book, The Undocumented American. And Dr. Kamini Dubé, emergency medicine resident physician at NYU Bellevue and soon to be attending physician and assistant professor at Columbia University Medical Center. Our conversation this evening has three components. Segment 1 will center on our panelists sharing key learnings and knowledge from work they've been leading and the expertise they bring. During segment 2, our panelists will share approaches and visions for building narrative power for health equity and racial justice. And in segment 3, they'll answer your questions. If you haven't already submitted questions, take the time to do so, and we're going to try to get to as many of them as we possibly can. So we're going to get to it now. We're going to begin this conversation. Narrative power, as defined by racial justice leader Rashad Robinson, who is now at Color of Change, is the ability to change the norms and rules our society lives by. Building narrative power is an absolute precondition for realizing social change. Our first question for the panel is to Amity. Amity, given all of the work that you and Color of Change have been doing around narrative power, would you elaborate on the importance of narrative power and shifting cultural consciousness, especially in the moment that we're living now?
Yeah, absolutely. I mean, I think, this is a moment we are 1 year and 1 day out from the murder of George Floyd. We're about 6 months out from getting a COVID vaccine. And so narrative power, really our job is to introduce new ideas and narratives, not only about public health, but about race and all of the other intersections that impact public health. And really give people a better lens to look through the realities that they're seeing in the world today during the pandemic, but also in their everyday lives, right? As like all of the existing public health issues that we saw before the pandemic are still very present. And so, that really means doing two things. It means removing harmful narratives and
Mhm.
replacing them with ones that are actually helpful to our society and move us forward. And it actually, I point out both because you got to do both at once, and be intentional about it. Is like an example is like during the pandemic, we hear there are lots of stories about how Black communities and communities of color are vulnerable, or Black people or Latino people are dying from COVID. And these are narratives that are just actually not true. Like,
Mhm.
communities of color are not vulnerable, have agency and ability to like defend and protect themselves. They're not dying. They're actually impacted by decisions and behaviors that people are acting out. And so the way that we talk about things can change the way that society thinks about an issue. If we say that people are dying, then the onus is on that person. Why did that person die? Versus people are being killed by systems and practices. Okay, now we can actually go and find the people that are acting, and replace those behaviors with ones that help our society. And so it's just an
Mhm.
example, but I think these two pieces, removing the harmful narratives and replacing them with helpful ones, are is really the core of narrative power, and is a practice that we need to practice every day. We need to look at the things that we say, the general things that you hear all the time on the news, or that you talk about over and over with friends. Is like those
Mhm.
narratives that repeat themselves. We need to dissect them a bit and say, are these true? Are they harming people? Are they holding people accountable, to change that we want to see in the world? With Color of Change, we do racial justice work. We are fighting for a more fair and human world for Black people, and that means really, you know, disrupting some of the narratives that are
Mhm.
just normal, of like Black people are told that they're the problem over and over while being attacked, and harmed. And so that's sort of the base framework that we're starting with. We're also in a
Would
moment
it be
when,
fair,
like,
let me just ask you, would it be fair to say that this is not just, you know, the behavior of white persons, but we may also even experience it, people of color visiting one upon another? Said
oh,
differently, I
absolutely.
was in a chat recently where I heard Black women engaged in the work of cultural competence talking about the culture of poverty and attributing to poor people, certain behaviors and conditions as though it was just a given.
Mm. Yeah, I mean, I think culture is not unique to specific races.
Hmm.
We see different people in power, right? And so those that hold power have an outsized responsibility, and can be held accountable, more than everyone else. But culture is all of us. It's
Right.
everybody, and that means that all of us have a responsibility to disrupt narratives that we think aren't working for us, or aren't moving our society in the direction that we want.
Absolutely. I'm going to pivot to Morgan. Please share with us how narratives show up in approaches to organizing and working with Black women. I don't know if we can hear you. Got a little problem with your audio. Let's see what we can do.
Yeah, is that better?
Got you now. Good deal.
Thank you for having me. How are you tonight?
I'm good because I'm with you all. It's a
Oh,
good
that's
place
really
to be.
kind. Yeah. The question is, how do we use stories and macro stories and power narratives in order to motivate people in movement building? Is that what you're looking for? Is that the
I'm
question?
asking specifically about your work with Black women. How are you working with Black women? How that shows up in your approaches to organizing and working with Black women.
Sure. So my name's Morgan, and I'm one of the co-founders of a powerful movement called Girl Trek, which is now over 1 million women, Black women, who have taken to the streets of their neighborhoods to walk for better health, to
Hmm.
walk to reconnect with one another, and to walk to reclaim the streets of their neighborhoods. And it has been a powerful movement to be a part of. It has been exciting. It's been humbling, sometimes infuriating. When a million Black women walking together and collectively organizing still doesn't feel powerful enough. All in, we are super excited to start to think about eliminating every single system that comes to kill, steal, and destroy together collectively. And so that began with telling ourselves we were worthy enough, right? For 30 minutes to go outside and take a walk. And that, it's not a super sophisticated answer around macro narratives or power narratives or anything like that, but it's insidious. The things we tell ourselves about our worth matter. And so I like to think about stories in two ways. Stories we tell ourselves and the stories we tell one another. The stories we tell ourselves are imperative when we start to think about behavior change. So for me, I had to tell myself I was more than the labor I provided to other people. And that if I took 30 minutes away from my computer, away from my job, away from my achievement, I wouldn't be 30 minutes less worthy, that I would actually be much healthier. We know that walking is the single most powerful thing you can do for your health, and 30 minutes a day is what everybody recommends. We were no experts when we started this a million women ago, but it has healed people, right? And it's mostly taking the time, getting outside, getting the sunshine, connecting with your neighbors, walking at the speed of life again, and slowing down. So that's one thing when we think about behavior change. And if the narrative is compelling enough, because it's true and because it's timeless, people will follow because people are incredibly intuitive, right? And so that's what we figured out at first. We were no experts. We didn't even have a bullhorn. We were literally two friends, Vanessa and I, on social media, who decided to tell the truth about our own lives. We decided to tell the truth about our own sense of unworthiness, about the dysfunction generationally in our families, about our frustration levels, about all sorts of things. And when we started feeling better, we started telling the truth about that. And all of our friends were like, well, let me be down. Like, what we gonna do? And so we said, all right, let's do a walking challenge for 10 weeks. We started super small. And then I think we also think about the narrative we tell others, which really does manifest in systems, right? So we tell others that Black men are frightening or dangerous, or we tell others that, there are greater priorities in the Middle East than there are in Flint, Michigan, right? Or that it's our job to be on the front lines of danger. We tell each other stories, which then result into policies. They result into systems like, the prison industrial complex. They are codified into systems. So part of what Girl Trek also does now that we've reached 1 million is we tell stories about seismic systems change and what that would look like if 1 million women stood behind it around a justice agenda. So that's what we're doing now, and that's what movement building looks like. And we learned that from our foremothers how to do that. So
I really appreciate this. Now tell me, you also are working with a framework, an act of self, that when you engage in this work and when you engage in caring for self or taking care of self, it's an act of self-preservation, not self-care. Tell me a little bit about that, because so many people say self-care, you got to engage in self-care. So what's the distinction to be drawn?
Yeah, well, first of all, we need all of the above. We need self-care, self-preservation, self-love, all of the above. And we certainly did not invent this. I mean, there's a whole catalog of womanist theology and liberation theology for Black women, by Black women that said this, notably by women like Audre Lorde, Bell Hooks, Nikki Giovanni, right? Yes. And so we certainly are standing on the shoulders of women who taught us well, who taught us how not to fall for the banana. Right. Yeah, so we know that this is not about bubble baths. We know this is about systems of labor and control and oppression and supremacy and cultural annihilation that has been intentional for exploitation, right? We know that. We understand that the fact that we are disproportionately impoverished in this country, that we are dying twice as high from maternal deaths, all of the statistics that everyone watching knows and is exhausted by. We know those things were built, right? They didn't just happen. They're not because Black people are inadequate or lazy or anything like that. this is intentional, right? So we know that.
Right.
And so one of the things one of the stories we have to tell ourselves is that we have to be relentless about the years. And that, we talk about Harriet Tubman a lot in Girl Trek, and we say, never ask permission to save your own life. And if that is the ethos, that we're not asking to save our own lives, then we better garner the power to be able to solve what seem like intractable problems, right?
Yes.
And stop waiting for and asking for systems that were built to destroy us to then save us. And so that means working with people who you might not agree with. It means working to change policy. It means working to procure federal dollars. So it doesn't necessarily just burn and tear down or anything like that, but it means advocating fearlessly and flawlessly for the liberation of your people and the healing of your people. And so that's what Girl Trek hopes to do.
And has the work been made more difficult in this COVID moment? Has it been more challenging? Given how...
Yeah, it's a good question. It depends on what work we're talking about. If we're talking about the work of healing ourselves, I would say no. It actually has been a heightened awareness around healing ourselves. It has been a tuning in, a slowing down, a turning down the noise in a way that I really want us to acknowledge, and to not then pick up the habits that we had in our lifestyles that were destroying us and dimming our lights, right? So I think... So in that regard, COVID has been a moment of reflection and reckoning for the world. And I want to take that pause and that breath together. I do. And I want to do power differently when we go outside our front doors this time. We've had the time to rest and to think. We've lost soldiers on the field, nurses, postal workers, people who made our world go round while we sheltered. And now it is time to go back out into the streets and to bring all of the beauty and energy that we have and have been planning for. So in that moment of opportunity, I am grateful. I do believe that COVID slowed down some of the progress of social justice. I think there was some momentum happening in the streets, and so I am personally committed to not lose that momentum now that the streets are back open.
Wish I had more time right now to break that down a little bit more. Maybe we can find some time on the tail end, because I want to learn more about that. I want to turn to Carla. And, Carla, your work, your writing has been lauded and applauded by many people, including our former President, Barack Obama. I want to hear from you how your writing and the advocacy that you're doing disrupts dominant narratives of Latino communities and people who are undocumented. We're having a hard time. I can't hear you. Let's see.
You know what? I'm a little out of practice with doing events, so I've been talking on mute, and it's so
It's all
embarrassing.
good. I say all the time, that's the new tagline. Like, we can't hear you. We can't hear you. Unmute yourself. But you're muted. You're good to go.
I'm a millennial, though. You know what I mean? I should not be doing this. I did a couple of things consciously, and then I did some things unconsciously. Consciously, I knew that there were I knew how the publishing industry worked, and I knew how Hollywood worked, and I know what kind of stories sell about Latinos, and I didn't want to do that. First of all, it's boring. Second of all, I think I'm a good writer. I think I could not be capable of writing like cliched stereotypes if I tried, partly because I'm a good person, and I think how do I stereotype people that I know very well from my neighborhood and my family? I would have to be borrowing from white dominant narratives in order to do that, and people do that. A lot of literature that is about immigrants, that is written by immigrants, does borrow from white dominant narratives. So one, I decided I wasn't going to write for a white audience, and that was something I did consciously. Unconsciously, I just fundamentally have like a pathological confidence in myself, and I just decided to trust myself every step of the way, and that happened to go against like what dominant what people in power wanted me to do every step of the way. Following my gut and following what I wanted to do with my art happened to be in direct opposition to what everybody had in mind for me, and continues to happen. What I want for my career is not what people envision for my career, because there's a script, right? If we're talking about narratives, there's a script, and I don't like scripts. Scripts again. If we're talking about sort of like stale pre-written things about race or about gender or about class, they're lazy. So as a writer, I don't want to live out the embodiment of a caricature that I know someone got from a movie in the 1940s. And as an artist, I made very conscious decisions not to do that, but also as a person, just being true to who I am and having confidence in myself, I just live and breathe, and I think that is, I'm going against the dominant narrative.
Are there writers who inspired you, who've inspired you or continue to inspire you? As you talk, I'm reminded of Toni Morrison and how she spoke to this very issue, how how others wanted her to write, through a different narrative, through a different frame that was not her own.
I hope you can hear me. I look frozen on the screen.
I can hear you. You with us?
Okay. I wish the frame was not so unflattering to my face, but yeah, a lot of the writers that I felt inspired by were Black writers, and the Black canon is something that I really looked to, and I think the very solid Asian American canon is something that I looked at as well. It's something that I think about all the time. When I was setting out this book, I carried around James Baldwin's book, The Fire Next Time. And what I thought about all the time was I want to write a book that someone can carry around with them during a time of utter turmoil, the way that I carried his book around like a talisman, but also at the level of the sentence. You can't, it's airtight. It's just airtight. You have to just admire the architecture of the sentence. So, and I was, obviously really inspired by the fact that he felt like his thoughts on being a witness, where he felt like he didn't want to write about some things, or he did not want to position himself in certain ways, but he saw what was happening in America, and he came back from France and he said, I have to pay my dues. And so I felt very similar.
I can appreciate that. I'm going to turn to Kamini, and I have to ask you, through your coalition and advocacy work, you've been able to bridge healthcare, public health, and social movements. And what I want to know from you are, what have been some of the key tenets to centering community power in your approach?
Thank you so much, Jennifer, and I'm so humbled to be with you. Such amazing, revolutionary people, and that's exactly what we need in this moment right now. So often, as Morgan spoke about, communities of color especially are treated as wastelands waiting to be saved. And in the case of academic medicine and the health sector as a whole, often researchers, public health officials, clinicians work with the quote unquote marginalized, bolstering their reputation. But whenever there is a group or a community of the marginalized, there isn't just the marginalized or the vulnerable and then baseline. Whenever there is a group of people or communities that are oppressed, there is another benefiting from that oppression. And sometimes, as gatekeepers of institutions, we are the ones benefiting from that oppression, no matter how we look, no matter the oppressions we've faced in our lives. So as a physician, instead of saying, like we commonly say, that I take care of everyone, we have to realize that we take care of all the patients, all the people that may reach the doors of the hospital. But 90% of health outcomes are attributed to factors outside of the hospital. And race, particularly racism, is the root causes of all of those inequities. So I must recognize who is not reaching my doors, step outside of the hospitals to learn, grow, and serve to the fullest of my ability. Those closest to the problem are closest to the solution. So oftentimes medicine, or organizing in particular within medicine, is branded. You know, we have these diversity centers. If it's more medicine, but once we're critical of the institutions for perpetuating injustice, it's no longer branded. We are ostracized, we are marginalized within these institutions. So we must recognize a couple of things to uplift community power. Race was constructed intentionally, systematically, to maintain white privilege. So we must dismantle whiteness and value Black lives. And so often it's prioritizing white comfort. It's not just saving Black lives, but it's saving humanity by finally valuing Black lives in our culture and in our hospitals. And then we must recognize that racism and capitalism are inseparable in the United States. We often prioritize profit over people, over our patients. We come from a history where Black people were treated as property. They were property. And even after slavery, white slaveholders were given insurance, cargo for lost property. We must acknowledge that history. And so often it is left out of our textbooks, it's left out of our curriculum, purposely and systematically. So we must count on communities, generations now passed on stories that's not evidence-based medicine within the hospital, but that is narrative power, right? Think about the evidence, think about how we approach folks when they're inside the hospital, someone struggling to breathe. You know, if someone says, I cannot breathe, or I see someone in respiratory distress as an emergency medicine physician, I do everything in my power. Intubation, I rush extraordinary measures, right? But George Floyd did not need extraordinary measures. He needed someone to value his life as a Black man. He needed dignity, he needed love, he needed respect. So love is the core of organizing. Love is the core of this collective liberation that we wanted, or that we all achieved, that we all seek to achieve. So I think we need to dismantle whiteness. We need to dismantle capitalism. We need to realize that often the institutions benefit from fragmentation of our solidarity as people. And that love is what binds us all together.
I so very much appreciate what you've said, and I want to center in specifically just in this moment on the inextricable link that you draw between racism and capitalism. So often in this nation, you know, and especially of late, we talk about the ending, you know, working together to end systemic racism, but we don't bring in capitalism and frankly, even militarism. You know, the weaponizing of systems to, you know, the use of power to keep people who society has sought to marginalize and oppress in a position of submission, if you will. And so I'm just so thankful to you because, again, we often just center on the racism piece, but not these other links that go hand in hand. And if we don't seek to undo them all, we're not really going to get ahead. I'm going to open this up for a group conversation now, where I want you all to talk about the approaches, the visions that you have for building narrative power for health equity and racial justice. And I'm going to open this up with Amity, but you know, I just want you to jump in, and then if others want to add, let's do that. It's going to be a little bit kind of like a rapid fire because we've got about 20 minutes to get in some key conversation, but we're going to do our best. So let's kick it off with Amity, and Then if others have to add, please do. What does the infrastructure for building narrative power for health equity and racial justice in New York City look like for you? What does it mean to anchor this infrastructure in community power? Amity, we can't hear you.
See, each one of us got to do that at least once. I think some of the other panelists really started off the answer to this. It's like rooting our solutions in storytelling and an experience of the communities that are impacted. I think is really the start. We've got to tell stories that show successful tactics and really highlight the folks that are doing the work that's working. So often we tell stories of what's not working, that we really miss opportunities to copy and learn from each of our trials with this work. And I think there's a big piece of this is rallying folks around real solutions. It means like, identifying the people and the behavior that is leading to the results that we want to change. Systems are built by individuals making individual decisions day to day. Systems are built by behavior that is replicated over and over again. And so if we want to disrupt that, we actually have to point it out and identify it for each other so that we can change it.
Like that. Others want to add to that?
Yeah, every time I think about, well, first of all, it's having real people at the table. I was in whatever infrastructures are required to do that, like literally putting more chairs around the table for decision makers and inviting people who are everyday people who are really to the problems and the solution should be sitting there. I think quickly about, I was at a march a long time ago, actually when Amadou Diallo was killed. And I was a student at Howard University, and Al Sharpton was leading a walk, and we get to the front, and the Nation of Islam was there with their bow ties, and they were, keeping the peace. And there was a brother who kept interrupting the program, and they were like, "Brother, not now." And he kept interrupting, and his books were disheveled. They were like, "Brother, not now, not now." And eventually they were like, "Okay, brother, what?" And he was like, "I just want you to know you're planning to march on Sunday, and none of the buses run on Sunday, so people can't get here." We need the voices of people in order to help us find solutions and interventions that are viable, that are accessible, that are affordable, that are practical, that are wise. So one just easy piece of infrastructure is invite more people to the table. I think also StoryCorps is doing a great job of that, of just like getting more voices out there rather than even filtering them through authorities or influencers or anything like that, but just literally amplifying real everyday voices. And then the last thing is there's a whole movement around solutions journalism that is led in part by some New York journalists from the New York Times, one of them, David Bornstein. And it really is this notion of finding solutions and amplifying those stories through news media and outlets. New York City is a huge content producer. And so really focusing heavily on solutions journalism, I think, is going to be one of the pieces to this puzzle.
Excellent. Carla, share with us ideas about how disrupting particular narratives could advance health equity in Latino communities.
I think that one of the things that I also noticed during the pandemic was how much emphasis there was on, and I noticed this regarding vaccine hesitancy too, how much we rely on things that, Dr. Morse talked a little bit about this, but on these explanations that we've already been given about why certain people don't seek medical attention or why they don't, there's this conversation about stigma, for example, in Latino communities and regarding mental health and how we don't talk about mental health and there's a great stigma around it. And what I found is that it's the words mental health or it's the words mental illness that we can talk about it without using those words, or we can define them to like people in our communities who are like elders, who are older, who don't have a formal education, who don't have the discourse and the language that we have. So a lot of the people who talk about how the Latino community blankets, don't have a stigma about mental health are people in elite media circles who are not really talking about the poor and the undocumented and people who haven't really had the opportunity to learn about this. And it's like, have you tried? Like, have you tried having these conversations? Because when you talk to people and you say, when you say you have depression and anxiety, they might get defensive. But if you say, you share some of yourself, right? You say, I have trouble sleeping sometimes, and racism in this country, the discrimination, Trump being president, it has made me, fatigued, living. I can't watch the news anymore. My heart races, and I started drinking more. And I need to figure out ways to take care of myself. And they'll be like, me too. And you're like, you know what? We all get sad sometimes, and what helps me is, whatever. And you can ease your way into that. And so I think that sometimes one of the narratives I try to disrupt has a lot to do with class and how we often don't take class into consideration when we talk about our communities, and especially the older people in our communities. Not everyone has the language that we do, especially if you're college educated. So that's something that I make sure to just make sure that it's accessible. And I'm a great writer, but also my writing is accessible. I explain things.
As I listen to you, what occurs to me is you're speaking more about like humanizing experience rather than labeling. And there's so much of that in this society. Are there other thoughts that people want to share on this particular point? Just, disrupting particular narratives to advance health equity. We've got lots of other ground to cover. Please comment.
I just want to bring light to Morgan for a sec. I think all of this work and everyone here, is done with solidarity and building movements, coalition building. In terms of that question, our society is definitely geared towards singular climbing of the ladder, achieving societal measures of success. Morgan said earlier tonight that this movement was started with her and a friend connecting over social media, now building a global movement. And it's all about coalition building. And I truly believe that, institutions that maintain white privilege power and racism really benefit from fragmentation. And it's on us in terms of holding ourselves accountable to bring people in, right? To create a net that truly works instead of networking for our own upliftment, building a net where individuals cannot fall through, listening to that individual that had a practical concern, whether or not buses would be available, to bring in others and grow.
And so let me just ask you, Kamini, as I think about what you just shared and helped us to appreciate all the more about Morgan and the work that she and her friend are leading right now, just, coming together and seeing the need and then responding. How have you been harnessing the power of community in your work, especially as people have been impacted by COVID-19?
So here, New York City, I work in New York City. New York City is one of the most top 3 segregated, residentially segregated cities in the country. And here, care is segregated. We don't use this term lightly, segregated care, really a multi-tiered health financing system with disproportionately Black and brown patients who are insured by public insurance, seen in safety net hospitals. Some of these patients were discharged in the middle of the pandemic without oxygen tanks, who needed oxygen. Some of them died waiting for ICU beds in underfunded safety net hospitals, while white patients were receiving multiple forms of experimental therapies in specialty centers. So recognizing that, we know that there are a number of hospital closures in communities of color. There were not hospitals, and where hospitals failed, communities were able to mobilize. So our coalition worked with the Red Hook Initiative the Young Men's Initiative, Neon's Neighborhoods, to provide volunteer physicians, medical students, residents, community organizers in communities of color, community power and resilience. So now, while many of my medical colleagues are writing about food pantries, let's recognize that communities have been serving each other with food pantries and not writing about it, but just doing it on a daily basis. They were able to medically screen the most fragile, at-risk elder members in these communities. So we did not approach communities as, once again, wastelands waiting to be served, but we saw unmet needs and made ourselves available.
I like it. I like it. Morgan, tell us how we can create more spaces of transformative change. How do we, essentially engage with people and help them to imagine a more just world? How do we create these spaces of transformative change?
Mm-hmm. When you say we, who are you talking about? New York City, or are you talking about who are you talking about? Because I think the answer is different.
We're talking like New York City, the Department of Health and Mental Hygiene, people who want to engage in this work, who see the need. So it's a society on the whole, but
I think the budget of the New York City Health Department has to prioritize community engagement, and I think it has to pay workers to do really vital jobs. So when we're talking about movement building, movements are built also on the labor of volunteers. And so one of the things that Girl Trek is doing is also creating workforce development and thinking about how do we professionalize the things that are necessary. So for example, the good doctor was just talking about movement building at large and then disparities within hospitals. You know, if you Vanessa and I, my friend who started Girl Trek and I, we gave a TED Talk. It was a great honor in our lives. And one of the things we talked about, this was a few years ago, was what would happen if there were groups of women walking down the street when young men like Trayvon Martin were killed, right? What would have happened? That is the power of movement, is bringing people into the room, bringing people onto the block. And so one of my thoughts, you know, even if there is one observer in hospitals, when there's a woman who is saying she's in labor and not being heard by physicians, by waiting room emergency care, and there was just one community health worker who could be an ally, who could be an observer, I think we could save one life. And so part of this is an investment understanding that people power matters, and that making sure that people are not isolated through the most vulnerable times of their lives matters. And it's not efficient, and it won't be life-saving efficient, but it's vital. It's vital. And so I think that's one thing that we would certainly love to partner with to do, is to source talent and to fill the roles. So whether it's writing walking prescriptions and having some of our members come to the clinics to lead people who are really struggling with diabetes or depression and loneliness and isolation, and lead walks from the doors, or if it's people who are coming in as waiting room observers for, or if it's doulas who are coming in, or if it's end of life doulas. I think that we have to look at the research and understand how to increase life expectancy for those who are most vulnerable.
Thank you. I'm like filled up with that, and in part just appreciating what was the experience for so many who were hospitalized and lost their lives during COVID, and you know did not have a trusted resource and there with them, or even frankly, I struggled with leukemia 10 years ago, and was comatose for many days. And I just remember waking up from the coma and being surrounded by love, trusted resources and supports. And that made all the difference. It made all the difference, not just for me, but for the other people, the hospital, the physicians, the nurses, to know that I had a community that was there with me. Let me ask the others of you, I just so appreciate what Morgan just shared, and I'm going to ask you all, what do you think is the one thing we need to reimagine for public health that centers racial justice, equity, and community power? And once you've answered that, we're going to go and hear from the audience some of their questions. So, Amity, I'll begin with you.
I think I think that there's a piece here where we need budgets that reflect our values. You know, budgets are moral statements, and so often they are treated like just dollars on a page, when actually they impact the way that health is distributed, and it impacts the way we respond to communities that are in crisis. And so, yeah, that would be one of the places that I would want to see some focus.
Most important. Carla?
Let me try to tackle just one of those. What were the different areas you mentioned?
Racial justice, equity, community power. What's the one thing that we need to reimagine for public health that centers on racial justice, on equity, community power?
I believe in coalition building, and I think that the organizers on the ground who understand that communities of color have a lot in common, especially in regards to the way that we have been victimized by capitalism. I think that there is enormous opportunities for growth in that area, especially in New York. I, really see a disconnect between what I think the media talks about and what I see among my organizer friends who do organize communities of, Latino workers and Latino people, and also among in various immigrant communities, Asian communities too, where there is such a discussion of LGBTQ rights, and also discussion of like anti-racism, and I just hope that there is more communication among the different different like sort of national groups that that fund and that oversee some of these smaller grassroots organizations, because they really are doing the heavy work in the communities.
Absolutely. And in this moment, I'm hearkening back to Amity's words and appreciating that so little foundation funding goes to support structural change. We need to change that. Philanthropically speaking, there's not enough dollars that are funding real change, structural change in our society. Kamini, do you have any thoughts that you want to add? And then we're going to go to Q&A.
I think, my answer to that question is simple. I really think love is the answer. One of my greatest role models is my mom. She grew up in Guyana with not much, but she taught me ever since I was small, there is divinity in every single human being. And it really, every single encounter makes a difference. Over the past couple of years, I've been practicing street medicine, and a man I've gotten really close to has lived on the street for much of his adult life. We're so close to finding him housing together, and he stores his stuff in my apartment, and we've just had conversations. And a lot of times we do all this advanced technology within medicine, but one of the simplest things he ever said to me is, love saved my life, and you loved me, and that's all that ever mattered. And to me, I think love must be the starting point for any kind of meaningful change.
Indeed, so well said. Let's take some questions from the audience. A couple of people have asked the question of what they can do as just members of their own communities to promote health equity. Suggestions that you might have for people getting involved and doing their part to promote health equity. think this is more of a, I may not be a leader, but, or I may not see myself as a leader. What can I do? How can I engage?
I think one really important thing is when you find a problem to advocate not just for charity or making things tolerable, but actually to advocate for changes that fix the problems, like actual justice. It takes some thinking through sometimes. As like, problems are thrown at us all the time. Like, this is wrong, that is wrong. But just like taking a minute and thinking through, like, what is the heart of this issue, can really mean that you have more narrative power when you're suggesting solutions.
Mm-hmm. Yeah.
I get asked a lot, sorry. I get asked a lot
Please.
what people can do after they read my book, and they're like, how can I help? And I'm like, well, know who you are and what is within your realm. Like if you're a lawyer, you can help in one way. If you have a lot of money, donate it. Not everyone can help in the same ways. And something that people don't sort of understand is when they read something about like kids in cages or something, they really want to help the kids in cages, but they don't understand the way everything is connected and the way that they have people in their neighborhood who are immigrants who they can be kind to, or they can learn their name, and or they can tip well. Make sure you tip at least 20%, and somehow that feels less savory than trying to help the kids in cages. So people don't think that that's something that they can do and like work on, or like be nice to Uber drivers, and make sure you leave. Make sure that you don't make janitors' jobs harder for them. Those things people don't think about. So I think, my advice would be like, think very local, think extremely local, think in your neighborhood, think in your own community, whether you can check in on people when something horrible happens in the news, people that you really know, that you're really friends with, and not just like a random Black or Latino or Asian person, but like people that you're really friends with, and find a way to make them feel loved, because I think that's how individuals who, if you don't have access to the structural paths, you can just make sure you can send someone dinner. If they're having a hard day, they work at a nonprofit, they're dealing with all of this. I mean, just think very, very local, and local often means like your family and your neighborhood.
One of the questions that came in is centered on programming and policy to strengthen centering on equity, health equity in this city. And I myself think about the soon changing of the guard, if you will. We will soon have a new mayoral administration. What are your respective thoughts about programs and policies that must be in place, must be embedded in our systems to ensure health equity going forward?
Can you all hear me? I was having some technical issues. You're okay?
Yes.
Can you all hear me?
Any thoughts on that?
Yes, thank God. I do. And I wanted to actually go back to the folks who asked how I can help. I think it's the most important question. And one thing we learned from movements like the Me Too movement is that telling the truth is one of the most important things we can all do. I was so inspired by your story about leukemia. And I actually think that health equity is so pervasive, but because there's a level of shame around, the fact that we can't pay our dental bill, or that, that we were treated poorly when we tried to get an abortion, or that we were, that we were lost in the hospital because, we're suffering from, Alzheimer's, or, whatever it is. I actually think that individuals telling the truth to their families, and if you are so brave, your greater community, and if you're even braver on social media, starts to create a fabric by which we can then have data points to talk about these things with people we really care about and know. So that's just one way I think we can all help, is to start to tell the truth about our own stories, because it's not far off people. And then in answer to your question around policy, I think we're going to have to look at data, measurements, and research. I think that it is vitally important that we reconcile with a racial lens some of the assumptions that we make from data sets that don't include us, right? So things like BMI, we have to reconcile it in New York City. New York City is so progressive. We have to reconcile those standards of what that are isolating, right? Or things like the food pyramid. That's when we know that upwards of 80% of Black people are lactose intolerant, like we have to reconcile those standards. And we then have to be very intentional when it comes to things like vaccines to make sure that there's a large enough sample of diverse Americans that are participating in this research. And so, it's a dry answer, but it's a vital answer, that the data has to be there before we treat. We have to have kind of critical race theory in medicine. You know what I mean? So that it's something to consider. Yeah.
Yeah, I very much agree with that. I think so often race is used when racism should be used in terms of research methodology for tools we use on a daily basis within medicine, in the clinic, in the hospitals. But also when there is publicly accessible data, in terms of the inequities, we do not need more studies showing disparities. We do not need more studies that show that hospitals that are private are pocketing funds for taking care of patients with Medicaid when they do not, when they send those patients to safety net hospitals. But how do we then transform all of that awareness into policy that can actually hold these institutions accountable? How could we hold our state DOH, our city DOH accountable to then hold these institutions like NYU, Mount Sinai, Montefiore accountable for taking care of patients within communities of color? Part of that is external pressure. Audre Lorde, who was brought up earlier, said the master's tools will not dismantle the master's house. So how do we use tools of organizing to then create policy to hold institutions accountable? And I think all of that is on us.
Indeed. Amity, did you want to add anything to this? Actually, you spoke about budget justice earlier, which is so critically important, and I think applies here as well.
Yeah, it definitely applies here. I mean, I think I definitely agree with the other panelists. Is like there's a wide range of solutions, but yeah, budgets are definitely one of them. Is like it's not just the big city budgets, but it's actually each line item has impact and can save lives.
Absolutely. We are just about out of time, and there's one last question that I want to pose to all of you that was asked by someone in the audience. It centers on mental health, and in many ways we've been talking about our mental health and well-being, but someone is asking, in this moment, as we think about self-preservation and just continuing to press forward. The question was asked, how do you essentially, how did they put it? How do you stay healthy mentally in this moment? And I'm not sure if they're asking you all individually how you stay mentally healthy, because it means something different for everyone. But why don't you all just tell people how you're staying mentally healthy? Maybe you're not. Maybe it's a struggle, right?
Yeah, I can start. I can start. Another answer to the last question. Budgeting also requires us to put money in, and decided to bring that up is because that's actually how I approach mental health. Is that I actually heavily in my mental health through time on task. So for me, that looks like waking up early. That looks like sunrise yoga. That looks like meditation and prayer. That looks like listening to books on tape, literally all this morning, juicing stuff like crowding out the negative with stuff that makes me feel good. And you know, there was a woman one time I was talking to, and she was talking about how she makes her plate, and she was like, I love fried chicken, I love all this stuff, but I just try to crowd it out with vegetables. I was like, it's a genius way to look at eating healthy. Crowd it out with vegetables. Same thing with mental health. Crowd out the trauma, the daily assault on our spirits with goodness. Like, if you like to garden, make it a point to garden every day. If you like plants, repot them next morning. Like, figure out what it is that makes you lit up, and be diligent and intentional about it. And then on a systems level, any mayor coming in, any president of any hospital system or of the healthcare system at large has to invest in prevention, because pandemics come, trauma comes, police brutality comes, and we have to be ever ready. We have to be ever ready to be resilient. We just do. So that's how
Indeed.
Thank you so much for that. I totally agree. I mean, I totally agree. I think, you know, we can't just expect people to be resilient, right? It's like we actually have to create the systems that protect and support them before things happen, and to prevent things from happening. So totally agree. And I will say, this is Mental Health Awareness Month. I saw really, for me personally, I have a deep practice for self mental health work, but I saw someone suggest naming some of your plants after yourself and like giving them love, and that has been working for me over the last few weeks. It's just a fun thing to do.
I like that. We've got to end. We're out of time. I want to thank you all for what was for me a great, enriching conversation. You helped me to learn and to grow and to center more. And my only regret in this conversation is that we didn't have lots more time, because there was so much that you shared that I wanted to unpack. And I just feel like if I could lean into each one of you and learn from you, I'd be so much better at what I do and how I show up in the world. So thank you all for your time and just bringing your whole selves to this conversation.
Thank you for having us.
Yeah,
Bye.
Thank you so much for being together.
All right, Dr. Morris, it's good to have you with us. Thank you for having me.
Thank you so much, Jennifer, for facilitating this conversation. And huge thanks to Amity, to Morgan, to Kamini, to Carla, for your incredible comments, for your inspiring words, and more than anything, for the work you do every day. We really appreciate you sharing it through this series and the conversation tonight. But mostly we want to thank you for pushing every day with the work you do. And Jennifer, we are so excited about your charge leading the Racial Justice Commission recently announced by the mayor, the opportunity there to push forward with anti-racism at a time when many people, policymakers, leaders across the country are calling for it, is just a historic opportunity. So we're really excited about your work and thankful for your leadership in this moment, and are looking forward to collaborating with you. We recognize it's a team sport, what you're trying to do, and we look forward to supporting you. But with that, we'd like to close out the evening. And again, thank you for tuning in for the third part of our Reimagining Public Health for NYC series, from March to April to May. The series has been building over time, and we have just been so honored to be able to create a space like this that allows for thought leaders, for organizers, for physicians, for artists, for all flavors and disciplines to share kind of their vision for what reimagining public health looks like. And I appreciated that the panelists this evening in particular ended up finishing with the important point that prevention is where it's at, right? I mean, that is the core of public health, and part of the way we reimagine it is actually revisiting those values and recognizing the ways in which we push for prevention and the ways in which we could do it even better. So really appreciated that the panelists ended on that note. And I just want to share a few final thoughts as we close out this third part of the series. Again, we're just grateful for everyone's time. We want to, again, thank the Fund for Public Health for New York City for the collaboration around the series. We really appreciate your support. And again, just a reminder that our March, April, and now May sessions in this 4-part series are available on the Health Department's YouTube channel. If you want to revisit them, listen to them again, share them with others, we, of course, would love that. And we hope that these conversations keep new ideas at the forefront about what it looks like to push forward into COVID recovery, and again, to reimagine public health for New York City. So we ask that you join us at our next and final session for the season in this public health, Reimagining Public Health series. The next session will be on Wednesday, June 23rd at 6 p.m. as well. And that conversation will be focused on liberation and reckoning for health justice. And last but not least, I want to remind all of you to take the post-event survey. The link is going to be up on the screen in just a moment for you to be able to go ahead and take the post-event survey. And again, we just appreciate your time, your presence, and your willingness to work with us as we support your vision around reimagining public health for New York City. So thank you, and see you on June 23rd for the 4th part of the series for this season. We look forward to it, and thanks to everyone for joining. Be well.